How much do UK dentists actually make working in an NHS practice? Hi, my name is Lynn, and I'm a co-founder of Denota, an all-in-one hub for dental professionals. Today, I'm going to be talking through the UDA system, the recent Band 2 changes, how much an associate should expect to get as their UDA rate, and how many UDAs should they actually aim for in a year. So what is the UDA system? UDA stands for Unit of Dental Activity. And in the UK, instead of a dentist getting paid for every single treatment that they do, instead they get paid by the completion of a treatment plan. So the UDA system can be broken up into different bands, and a dentist gets paid based on the type of band that they complete. Let's look at the different UDA bands. Firstly, we have Band 1, which is equivalent to 1 UDA, and this involves any treatment involving examinations with radiographs, scale, fissure sealants, placement of fluoride varnish. Next, we have Band 2, where a dentist gets paid 3 UDAs, and this can involve any number of fillings, extractions, root canal treatments, denture additions, and any periodontal treatments. Next, we have Band 3, which are usually any lab-made procedures, and a dentist gets 12 UDAs for this, and this involves things like dentures, bridges, night guards, and splints. Then we have Band 4, which is equivalent to 1.2 UDAs, and this involves any emergency treatments such as an emergency examination, pulp extirpations, extractions, antibiotic prescriptions. So based on the completion of these UDA bands, a dentist will then get paid the number of UDAs mentioned. So immediately off the bat, we can see there are a few problems with the UDA system. Firstly, dentists are not getting paid proportionally for the volume of work they're doing. Take the Band 2, for example, where a dentist gets paid 3 UDAs. Basically, they get paid the same amount doing 1 filling versus 5 fillings. Secondly, they're not getting paid proportionally for the difficulty of procedure or the time spent on a procedure. For example, a dentist will get paid the exact same amount of 3 UDAs to complete 1 extraction, which might take 10 minutes, versus a root canal treatment, which could take about an hour and a half. Next, we have the issue of a dentist not really getting paid enough per UDA. In light of the issues mentioned earlier, the government in November of 2023 introduced some Band 2 changes to try and make it fairer in the way that dentists are rewarded for their work. So Band 2A, which awards a dentist 3 UDAs, remains relatively the same. The difference is in the introduction of Band 2B and 2C. Let's look at Band 2B first, where if a patient requires 3 or more fillings or extractions, or they happen to need a root canal treatment that isn't a molar tooth, a dentist will now get 5 UDAs instead of the usual 3 UDAs. And looking at Band 2C, if a dentist has to perform a root canal treatment on a molar tooth, which arguably will take more time and is more difficult to do, the dentist will now get paid 7 UDAs. So I think this is a step in the right direction for rewarding a dentist for the sheer amount of work they have to do, where it only makes sense if you need to do more work, you should get paid more. And if a procedure is more complicated, you should also get paid more for that. Next, we have patient charges, which is basically the amount that the practice collects from the patient. And the values are shown here according to their bands. This is not something that the dentist will get. This is something that's collected by the practice and then is returned to the NHS. So tracking all the UDAs that you've done across different practices, if you're working in a few, as well as the private income that you make, can get a little bit complicated. And so I'd just like to show you here how Denota can help you with your admin in terms of tracking the number of UDAs you've made across different practices, as well as your private income, your expenses such as lab expenses, and write your notes under 15 seconds. So if you're interested in trying that out, head to the website. So you're looking to start your dental associate job, and you're wondering how much you should be compensated per UDA. So in the next section, we're going to be looking at how much you should get paid as an associate and what your UDA rate should be. So to overcome some of the challenges of dentists leaving the NHS for private work, the government has now set a minimum rate contracted to practices. So the minimum rate for 2023 per UDA is £23, and for 2024, this has been increased to £28. Now remember, this is the amount that the government pays each practice for every UDA that is completed. Now, how much you get paid as an associate is based on your agreement with the practice owner. You could do it as a percentage split, which in my opinion is the fairest way. And a normal percentage split you're looking for is about 50%. Or some practice owners might give you a fixed value, and that value ranges from £10 to £14, depending on your geographical location. In my opinion, if you can, I would try and negotiate a percentage split. That way, you always get an increase in your UDA rate from year to year when the government increases the minimum UDA rate. Next, let's look at the typical number of UDAs that an associate would carry out every year and the breakdown of the earnings associated with that. So if you're just transitioning from dental foundation training or dental core training and you want just a bit more time to get on your feet as a dental associate, I would say this is a good figure to aim for. If you're working full-time, 5 days a week, I would say 5,000 UDAs would be a good amount. This ensures that you get a decent regular income from the NHS system, but also giving you some flexibility for private work. And this number of UDAs that you should achieve then reduces proportionately based on the number of days that you're working. So for example, if you're only working 3 days a week at a certain practice, then I would aim to have a UDA target of about 3,000 every year. In this scenario, let's say you're working full-time and you have a UDA target of 5,000 per year. You have a rate split of 50% from the £28. So you're going to get £14 per UDA. So that would bring your total up to 70,000 per year, just solely on the NHS UDA system. And of course, you're looking to make some income through private treatment as well. And as a very conservative estimate, let's say you're making 20,000 for the whole year. And so 20,000 on top of that 70,000, you're looking at about 90,000 gross income. But don't forget, you'll still need to deduct some of your lab bills and other pension and superannuation contributions. So as mentioned earlier, Denota is the all-in-one hub for dental professionals, where it helps you track your various UDAs and income from different practices, which are most often using different softwares. As mentioned, Denota is your all-in-one hub for dental professionals, and it helps you track your UDAs directly across different employers. It allows you to then track your private income per appointment, add expenses like lab bills and any courses you attend throughout the year. It gives you a breakdown and financial analytics per appointment and per workplace. Plus, our smart AI writes your dental notes in under 15 seconds, truly taking care of all your dental admin.